This podcast is a quest for well-being, a quest for a meaningful life through the exploration of fundamental truth. Enlightening ideas, insights on physical, mental, and spiritual health. The inspiration is love. The aspiration is to awaken new ways of thinking that can lead us to a new way of being well. Welcome to Body, Mind, and Soul Healing Conversations.
Our mouths are the most efficient, self-healing machines of all our tissues. We only need to treat them with respect and feed them lots of healthy foods. We need a new approach that feels like skincare, gentle, nurturing, and supportive. An approach that allows us to feel like we care about our mouths instead of scrubbing them out like we would a toilet twice a day. Let's show our mouths some love and respect. Valeria interviews Dr. Camille Zenobia. She is a microbiologist, oral health activist, founder and CEO O Salutum, podcaster, and speaker. With over 14 years of experience in the field, Camille is a trusted authority in oral systemic health. From her extensive research to her work with industry leaders like Colgate Palmolive, she has dedicated her career to understanding the connection between oral inflammation, microbial dysbiosis, and overall well-being. As an editor, author, and advocate for oral health education, Camille is driven by a passion for spreading awareness. She leads an upbeat podcast, Let's Get Oral, where she shares her knowledge, interviews oral health leaders, and offers insight to empower both professionals and individuals to reconsider how we regard and address our oral health. With Camille's guidance, you can expand your understanding of the oral systemic connection to improve patient connections and outcomes. Meet Dr. Camille at CamilleZenobia.com, asacare.com, and Instagram.com/oral health activist. Here's the interview with Dr. Camille Zenobia.
In your own words, who is Camille Zenobia?
Well, I'm kind of a silly nerd. I got really interested in how our body reacts to the world, and that led me down this pathway of trying to understand how we interface in all the different ways. And oddly, it brought me into the mouth, and this is where I became fascinated with how our mouth engages with our external world and how it informs us in health and disease and good feelings and bad feelings. So it's been this circuitous path, but it does have a spiritual element. But my nerdiness is rooted in kind of scientific methods. Yes. So it's this weird merging of fields. Yes.
Well, I love that aspect of being human, being curious, right? Finding truth. So that's very scientific. That's very spiritual too. All of us spiritual seekers, we are looking for truth. We want to find what the truth is, within this reality. Yes. And I see that with scientists too. You beautiful people too. It's curiosity, being open, right? That's just wonderful to me and fascinating. So I wanted to make a comment about something that I heard, since you care for the mouth and it's all around that area, the part of the body. I heard from somebody long ago, that must have been 20 years. He said, it's the mouth. It's such an interesting part of our bodies because it does three things. We digestion begins in the mouth. We eat with our mouth, we talk with our mouth, and we breathe. We could breathe through the mouth as well. So he said that actually becomes very complicated, and that brings a lot more, perhaps, issues to that area. Is that something that you have contemplated? I'm sure you probably have, but isn't it amazing that the mouth does all these things, and the nose and the eyes, that they only have one? I mean, I think that they only have one function. But talk to me about that for a moment, Camille.
Yes, I think that the mouth it is multifaceted. I mean, we think of mastication, chewing our world.
Yeah.
How we learn about the world is if you observe a baby coming into this world, the first thing that they do is touch things and put it in their mouth.
Yeah.
And that is really the essence of kind of how we start our learning journey as an infant and growing into this world, is by tasting and really sensing all of these components in our lives. And only recently have we realized that the mouth, though we do and can breathe through our mouth, it's actually more beneficial to keep our mouths closed and use our nose for breathing. And this actually creates structural changes. Within 6 months, if you become a nose breather or change to a mouth breather. And so there are so many facets of the mouth that I am personally just fascinated by. There are taste receptors that inform our immune system. There are nerves that react to our food and our microbial communities that directly converse with our brain and neurons and can affect our mood. And so it's this multifaceted entrance into our body.
Right.
Yes, I'm just deeply invested in the mouth. And and I want to pass along the message that, you know, we do so little in appreciation of that cavity.
Yeah. Yes. So, You see, that's really caught my attention as a message, a profound one, being gentle, right, with our mouth. I mentioned off record, you say showing your mouth love and respect is an important thing to do. So I never thought it that way, although I've been always using mouthwashes and looking for toothpaste that are fluoride free, you know, mostly from herbs, made from herbs or natural ingredients. I've been very much aware of that, but that because I'm always looking for anything that's gentle in general for my entire body, not just for my mouth. So that was natural to just look for the best gentle ingredients in my toothpaste and mouthwash too. I have lots of questions here about your work, but before that, just a question came to mind. Do you from your experience, of course, as a scientist of the mouth of that area, is that our strongest sense, would you say, is the taste? Or?
Well, I think that we don't fully appreciate how our taste receptors are really informing our bodies in real time, how to respond to what we're putting in our bodies. And as scientists, we're learning very quickly that the taste receptors are not only in our mouth, but throughout our bodies. And so the bitter compounds that our microbial communities create can actually have immune benefits or immune challenges. And, we're just starting to uncover some of these puzzles. But yes, taste is a huge factor. And we know that there are people who are very sensitive to bitter flavors, and they end up being kind of picky eaters. And then there's non-tasters, and there are different trends in health risks for these two types of people. I would say there's three, because there's the super taster, there's kind of the middle of the road taster, and then there's the non-taster. And so that can be, it's just a fascinating arm of the oral mucosal research. Right. But it turns out that they have the taste receptors, specifically the bitter receptors, help in that tissue turnover process. So if you eat bitter foods, you have a better regenerative mouth tissue.
Oh, wow. That's great to know. Yeah. Wow, that's wonderful to know. Yeah. I don't eat too many bitter things. My husband loves aloe vera. That's very bitter. So he's in the right direction.
Exactly.
Wow, that's a great tip here for all of us listening to this. Wow. I mentioned off record to you as well that I recently couldn't find the mouthwash that I usually buy, and then I just replaced with something new, a tonic. And that was a really interesting experience because my body instantly reacted to the ingredients in that product, and my stomach was affected immediately. My immune system dropped. I felt sick, weak for 1 to 2 days, and I continued to do it just to see if that was coming from that tonic, and it did. Wow. So I had to stop using it, and I returned. So talk to me for a moment about that. I know the microbiome, does it have to do with that, the good bacteria, that everything?
I would imagine probably. Not knowing what exactly is in there could be a host of different things, but typically I would say most oral care products the goal is to remove the microbes because they've been kind of chosen as the demons of our oral health. And that's not necessarily true. And in fact, as we're finding out more recently, some mouthwash can really disrupt the oral microbiome, and it appears that it puts us at risk for increased health risk for diabetes and cardiovascular disease. And that is because the majority of the nitric oxide cycle that is responsible for our healthy blood pressure starts in the mouth. And the oral microbiome is key for initiating that nitric oxide cycle. And so while we can survive without it, as we age, our efficiency to create that nitric oxide by ourselves with our host metabolism diminishes. And we rely more and more on our microbiome for some of these activities. And so when we've disrupted entire community, we now have compromised our kind of backup system, if you will. And so we're starting to kind of walk back this idea of antiseptic and alcohol approach to oral care. But it's slow. And, people like you and I who have been looking at alternative lifestyle options are kind of, I would say, on the frontier, whereas kind of bringing the rest of the world with us is a bit of a hurdle. And it goes back to what you were drawn to in the first place, which was to show our mouth some love and care. We, since the 50s, have been taught to scrub our mouths out like it's a dirty toilet. Yes. And so we have this really awful perspective of the oral cavity. And in fact, if you go into Target today and go to the oral care section, it is right next to like the toilet cleaners. It's in that area. And I just find it so incredibly offensive. It really shapes how we think about the approach to our oral care. And I would really like to shift that.
That's wonderful. Yes. Yeah. Thank you for doing what you're doing, Camille. I know it's a slow process, right? To get most people to understand that. My husband, I have been trying since we met 15 years ago. And I talked to him immediately about the toothpaste. And just now, I think 5 years ago, he changed. And he started buying like fluoride-free toothpaste. But think about 10 years. He was not listening or not even paying attention to that message. And he would see me doing that, but he didn't because he was used to, the narrative of any toothpaste is good for you. Will do the job.
Right. Right.
And yes, you're about to say something. Yes, Camille.
Oh, I was going to say, I'm not I won't walk away from fluoride. I think that there are some cases where fluoride is helpful, but I will say this, most of the tooth care, oral care, take home toothpaste is formulated without regard to gentle factors. So a lot of the other excipients or other ingredients outside of fluoride can be really irritating for our mucosal tissues, and we don't necessarily sense it, but we do end up in the dental office, and they might be harping on you for not brushing and flossing enough, but you're doing all the right things and somehow you're not getting the right outcome. And that is often because we're not reconsidering our oral care regimen. So even if I tell people this, if you want to stay faithful to fluoride and you think that it's creating a benefit, there's a very quick and easy solution. And that is go to your dentist and get the fluoride varnish. It's like $20. And it lasts for 3 to 4 months. But you don't need to put it in your mouth every day to get the benefit. If you're really attracted to the fluoride promise, you can get creative here and find other ways to get your fluoride if that's what you feel you need.
So that's interesting. So it's not, if I understand correctly, so not all of us need that, Camille, the fluoride?
Right.
Oh, not all of us, but some of us might.
No.
Okay.
I mean, you think about the human population and you think about all of the pharmacology that we have. There's no drug in this world that is one size fits all.
Yeah.
And so I think that we've done a disservice to oral care in that we typically think of one ingredient for everyone. And clearly that's not how we're built. And so I think it's a mistake to just rely so fully on one ingredient and think it's going to be enough.
Yes, because you're right. We are so different. Very, very true. Very unique, right? The bodies, and sometimes it's easy to say that we are all the same because we were all humans, right? The human species,
right.
But it doesn't work that way. Another curiosity that I heard recently was I think Joe Rogan. He talked to somebody. I don't know if it was a hygienist, someone about dental products, and he was talking about the color. The toothpaste, it has a little tag. It has a dot, like the very end, the opposite of the opening place. So the other end has a little dot there that looks a little bit like almost like how can I explain that? It's as a mark that has a color. So in the middle of the end of each toothpaste. And one is black, it can be blue or green. So they all mean something. And I didn't know that. So are you...
I didn't know that. And I worked at an oral care company.
Yeah, so this is a good time to talk. Actually, you do have now the Oza Care, right? They offer toothpaste and mouthwash. Yes. So was fascinating to me. I don't know how true that is, but they talked about, he said, being on the lookout to just always look for that. If it is black, that means it's mostly chemicals. If it is blue, that means it has some medication plus natural ingredients. And if it is green, then it's all natural. So you never heard about that, right, Camille? Oh.
No, and I worked for Colgate.
Yeah.
So
yes.
I don't. Yeah, I'm going to go look that up now. Yeah. Is it manufacturer specific or? Now I'm curious. I'll have to go do my homework.
Yeah, I was very curious about that too. And the first thing I thought about when I saw your products, let me see the end. It came to my mind. I got to look to see that mark, if it is black, blue, or green. So
we don't have that mark.
So all white, perhaps. That would be interesting too. If you have all white or no mark at all, then it's 100% natural, something like that. He didn't mention that. It's okay. You're off that list.
I'm off that list.
You are. Good. That's good. So talk to me about that, since we just mentioned the Oza Care. I have the website here, so it'll be on the podcast notes. What inspired you? What's the main purpose, which you have been talking about? I love the way you care for us humans. But what was the inspiration to come up with something like this? It's a beautiful initiative.
Well, I was looking at ways. So I studied oral inflammation. So the gum tissue that surrounds each tooth is this really cool specialized tissue. And it's where we have that highly coordinated response to our oral microbiome. And it's an ongoing conversation between us and them. And what can happen in life with chronic stress or, mastication, dry mouth, pharmacology that creates a dry mouth, a host of issues that can arise during your lifetime that create ongoing low-level chronic inflammation in your mouth. My goal was to see if I could correct it. So I was exploring, our typical oral care ingredients to see if we could solve the problem with those. And so I had created in vitro assays. So these are just cells in a dish that I can kind of test my theory. So I had been using a type of assay so in our gum tissue, there are these white blood cells called neutrophils, and they're very, we have so many in our mouth. There's 40,000 neutrophils per minute coming through our gum tissues, which is astounding. That's a lot of effort for our body to make all of these cells that we just throwing out into our saliva. But when they're chronically activated, they can actually cause a lot of damage. So if we can inspire them to quietly go to sleep, this actually initiates wound healing. And once we get that wound healing cycle to initiate, we dampen down that chronic inflammatory cycle. Wow. So my goal was that. And I discovered this very common skincare ingredient that we see in really nice skincare products called niacinamide. We know it's anti-inflammatory, and it had been evaluated as a mechanism to put these chronically inflamed neutrophils to sleep. And so I thought we should definitely want to kind of explore that opportunity. And indeed, I did see that we were able to kind of rescue that chronic inflammation. And I had a researcher at the University of Toronto who's a periodontist evaluate it in salivary neutrophils that we're taking from people with chronic periodontal disease. And you could see a nice titratable effect, meaning the higher the dose, the more effective. And it was able to turn down those inflammatory receptors on the neutrophil cell. So that's how I kind of discovered the skincare ingredient for the mouth. Wow. The problem with niacinamide is that it is terribly bitter.
Bitter.
Which means it's good for your gums, right?
I learned that today.
So it has a dual purpose there. And so I had to collaborate with a really talented flavorist to help make my oral care a palatable proposition.
Yes.
Anyway, so it ends up being kind of skincare for the mouth, which is why I went kind of for a beauty branded look and feel. But I also think that it imbues that desire to care and really nurture your mouth.
Yes. And it looks, the design, I love the design, the colors, they are very soft. They inspire that gentleness.
Yes, good.
Kindness.
Yes.
So that was one of the ingredients I heard. There's another one, I'm not sure if you mentioned here today. It's very technical for me.
Yes.
I don't know how to pronounce that.
Hyaluronic.
Yes.
So that's not in the toothpaste, it's in the mouth serum. So I designed a serum instead of a mouthwash that is more hydrating and works with your mouth gum tissue. I think mouthwash can be a little bit too dehydrating for some. There are many people who have dry mouth issues. So the hyaluronic acid or hyaluronin has been used for treating gingivitis, oral inflammation, mouth ulcers, dry mouth. It's used after surgical treatments to help regenerate tissues. And so I coupled it with the niacinamide for that mouth serum to have that mouthwash benefit, but for it to be more soothing.
So that's I read that, but I couldn't really, I didn't know much about it. You really explained and made it very clear now. So it's all about, again, going back to the message of treating the mouth with love and care, being gentle about it. So, and at the same time, being effective, right? And prevention.
Yes.
And
there is some studies that show if you can solve the inflammation, the microbiome of the animal will come back to balance. And so I was looking for an alternative way to balance out the microbiome instead of targeting it. So there's a lot of approaches to target certain perio-pathogens, but look, they're part of our community, and as long as they're in low numbers, they shouldn't be causing us problems. We need to create and find balance. And we know that most of our lifestyle is out of balance with, I work too much, I stress, I clench, I don't sleep enough, or I work out too hard, or, I've eaten the wrong thing. And how do we get back to balance? So, yeah.
Wow, what a beautiful and insightful invitation. Camille, I can't help but kind of look at the wildlife, when I watch these documentaries about lions. I love lions. And you see that, they are always in search of the balance, right? It's always, some of them, of course, the lions especially, they're very much into family communities. They're very connected. And as you were speaking, that's what came to mind, how ourselves, the microscopic world of the body, the universe of the human body, it works very similar. So we are not to try to, let's say, eliminate a species, from our wild inner world, be it right, physical or spiritual or emotional. But it's to find balance, understanding too. It seems to me like the closer we get, like you do, the more we get to understand how life operates at all levels, we are able to bring that into the picture, balance, harmony. It's just so obvious to me. What an amazing insight. Yeah. I mean, I love those. I get goosebumps.
Yes, exactly. Well, and so like some of the perio-pathogens, there's one called, we'll call it F. nucleatum, Fusobacterium nucleatum. So that one is what we call a bridging microbial species, where it comes and sits down, and because it sits down, you now can build more biofilm on top of it, because it ends up allowing other microbial species to come sit with it. And that's why we call it a bridger. And originally we have categorized this as a perio-pathogen because perio-pathogens that we've considered bad can sit on top of them. And what we found is that bacteria is actually key for creating the community that allows us to break down the nitric oxide. And so we, again, don't want to get rid of it. We just need it in the right low number, right?
Right.
And then similarly, there's another perio-pathogen called Porphyromonas gingivalis, and this gets demonized all the time. And it's been associated with Alzheimer's, all sorts of diabetes, rheumatoid arthritis. And so, of course, there are many efforts to eliminate it, like you said. And yet, one of the benefits is that it eats up excess inflammation. So I think in very small numbers, it's actually providing a service. It's when it's out of control and we haven't created a nice boundary with a healthy tissue that it grows out of control and creates problems. And so again, always when we're trying to, get the numbers down, we have to soothe the inflammation so there's less food for him, and then he can, be in his low numbers and we're all okay.
Yeah, that's it. You see, beautifully said, explained in a scientific manner and language. Because I'm always looking, to see the big picture. I love the big picture of this, this which we call life. And I see that clearly. So I have a question for you. Have you actually found, have you seen, have you read anywhere about a life form that has no benefits to other life forms? That's always, it's there to actually destroy or be of harm. Have you come across anything like that, or all of them? It's exactly what you said. It's just creating boundaries and creating the sense of harmony.
I mean, I think it's easy to limit your view to a certain set of rules. So like when we think of, I don't know, something terrible like tuberculosis, we want to eliminate that. And certainly we don't want to be ill.
Yeah.
But when you broaden the context and understand that sometimes we can have a benefit by being exposed to a low level. There's certainly been many pathogens that have shown if we're training our immune system, we actually get an incredible benefit from being exposed. It is very contextual, but no, I don't see anything as a black and white. I think that there is always something to learn and always something to benefit.
Yes, a billion times, because, that's in a way, a confirmation of what I have kind of come across in a spiritual way, from a spiritual view, that life itself or consciousness would not create anything that it's not of use per se. Everything has a function. So if they created, consciousness created the predator, and then we'll create the prey. So it's that, again, it goes back to this beautiful illustration of nature, the natural world, how it operates. It's just so clear to me that everything is connected, that we can try to isolate and disconnect or destroy anything, any living thing, under those that concept, this idea that's bad. I think good and bad is really is an interpretation of our human minds.
Exactly.
I love the bigger view, though. So with that in mind, I can't help it. Do you have any spiritual ideas, views, perspectives of yourself in this world, Camille?
It's such a private world that I occupy in my spiritual sense, but I definitely commune with nature. I go for a sunrise walk every day. I think that's a really important piece for me because it creates this vibrancy and vigor that really just inspires me.
Yes.
But I will also say that something that I don't divulge too many. I have a very strong inner world where I feel like I connect to my ancestors internally, and I check in on them and we have internal conversations. So I know that might sound crazy for some, but I think that it has given me a robust center that I feel emboldened in many ways that I don't feel like I need so many external validation pieces that I have this inner source of strength, and I really put it on my spiritual world for that. So.
Oh my God. Yeah, that's beautiful that you share that too. Yes, that's definitely part of what we call spiritual is really the invisible world, right? Something that cannot be tasted, seen with the human eyes, touched, but it's there. It's as real as, the sensory world, the world of perception. So it's so amazing to see people like yourself, a scientist, kind of realizing that, being in touch with that, what you call the inner world, the invisible world. That's actually, to me, more supportive a lot of times than our, physical world. So let's see. So I want to mention again, so your products really very interesting to me. I will try them. So they microbiome safe, curated botanicals, ingredients are gentle, fluoride free. And I love the design. That's the woman thing, I guess, in me. The design is so beautiful.
I have to say it's compelling for men too. I am often surprised by how many men also purchase our product because I don't think it's too girly, but it is very very beautiful, I
Yes,
think.
yeah,
Too.
that's the word. Yeah, it's beautiful. Yes. So, also want to mention, Camille, that you host a podcast as well. It's called Let's Get
I
Oral.
do.
So, talk to me for a moment about
Yes.
that. Is that on iTunes, Amazon Music?
Yes. It's all of the places where you would typically get an audio podcast. That's where we host. But it is all things about the oral cavity that I find deeply amusing. So I have a whole episode on taste receptors, for example. I do a lot of interviews because I'm very well connected with the scientific community, and I really want them to have a voice with the consumer, but also, the profession, because I think the profession can use some, distillation of some of those scientific findings that get kind of weighted down in these heavy, thick journals, which are hard to read and less accessible. And so I really just wanted to make something palatable, pun intended. To get the message out that the mouth is really this fascinating aspect of our bodies that it goes largely unrecognized.
It's so true. I love the title is your label, one of your labels, Oral Health Activist. Yes. You see, that's wonderful though. What's not to love about it? Because I do know I'm very aware of the interconnectedness of everything. So by taking care of one part, we're actually taking care of the rest of the whole. So that's really wonderful.
Well, like you said, you had the insult to your gut from an oral care disturbance. And that we know that if we have oral pathology, that can affect our gut health too. So it's all very much related. And if we're ignoring one but trying to treat the other, well, we've lost a piece.
Yes, yeah, that's it. And I interviewed somebody recently about breast cancer, and she showed me a picture. What do you call that? And it looks like an X-ray, but something else. That looked like some bacteria from the gums. They were coming down through the neck to her breasts and was causing breast cancer. That was like, an eye-opening for me. I was shocked by looking at those images.
I think that we don't appreciate just how mobile our microbiome can be in the wrong context. So if we have just a little bit of inflammation, if we have a little bit of bleeding gums when we floss, that is an entry point. Like our gum tissues are very, they don't have tight junctions like the tummy, like the gut lining. And so if we have just even a little insult, you can bet that you have a low level of bacteria going in your blood. And that can create a whole lot of problems. And even if you don't notice it, there's a low level of inflammation associated with that can cause downstream problems. We've seen a couple studies now where if you have oral inflammation and then you get a secondary insult like gut inflammation or, just another insult entirely, that secondary insult can make both the mouth and that gut inflammation so much worse than it had it been just a one insult.
Right.
So we call it a two-hit model. If you have two inflammatory insults, one starting in the mouth, it's going to exacerbate the whole system.
Yes, that's very clear to me. You even said in an interview that you gave, you said, our mouth are the most efficient self-healing machines of all our tissues. So that caught my attention. I highlighted this part here. Yes, so it's amazing how everything's connected. That's so clear to me. Oh, another question. So I'm curious about, you mentioned your products is a citrus blossom toothpaste and then citrus blossom mouth serum. You did talk a bit about the difference between them. Would that be okay to replace my mouthwash with the serum? It's actually better.
That's the goal. Yes, exactly. Yeah, it's going to be. So again, most of the mouthwash is kind of formulated to diminish the microbiome. And, the more natural products are hopefully going to leave it balanced, but it can still be kind of drying. So I just wanted something that was more soothing and regenerative, but had that kind of hydrating feel. Because I think that we really need to kind of keep it this moist, thriving.
Yes. So
Yeah.
that's the, yeah. So, because, a lot of people are used to the words like mouthwash. I remember with the milk industry with they labeled soy milk, and there was a huge fight,
Yes.
not to label that milk. But this is actually better because more hydrating. So I love that.
Exactly.
I love that. So, okay, we're almost at the end. I do have some questions, open questions that I wanted to ask you. I actually wanted to ask in the very beginning, but we just kind of danced in a different way here. That was wonderful. What is your idea of let's say wholeness, of being healthy? How would you describe the concept of being healthy in general, Camille?
I think of being healthy as having an inner glow. There's nothing that kind of calls your attention to it. So like, I don't notice that there's something bothering me on my foot because I'm just, that there's not anything pulling my attention away from just me enjoying life. And there's a vibrancy. So, I was actually interviewing a woman who went through a considerable amount of surgery to open up her airway. And what that did was it reorganized her facial structure considerably. And she looked like a very, very different person from where she started. And I thought she looked so incredibly beautiful, but I could see that she looked so distinctly different. I asked her if that was okay with her, because that's a lot of surgery to go through and then to have a whole different face. Yeah. And she said there are still times where she looks in the mirror and doesn't recognize herself. But she feels so good in her body that she doesn't care.
Wow.
And I think that speaks volumes. Like, she changed her whole face and feels so vibrant that she doesn't even care that she looks like another human, that's wild.
Yeah. It's funny you say that. Use that word. That's wild. It is wild. Yes. You see that's very spiritual to me too. It's like be identifying more with the inner reality, right, than the outer reality. Yeah. But yes, the pain can cause a lot of distractions, right? If we have illnesses, they'll be so distracting. It's not easy to kind of express this sense of well-being and wellness if we're in pain. Another open question for you is: what is your idea of success these days? What is to be successful to you?
That's a great question. And I think for everybody it's going to be different, but I think that we often, especially here in the States, get consumed with that kind of competitive salary, monetary outcome. But I think success can look really different for everyone. And, but part of that is being mindful about what success can be. So taking the monetary piece away or off the table, I like to, there was somebody who was talking about, you have your kind of professional CV, and then you have your personal, what did they say? Like, I think it was whoever gets to read your eulogy. Yeah. That's what you're kind of peppering in, because what are people going to take away from you as a person and how they engage with you, and all of those kind of relational opportunities that you get to be part of. So I love my family. I tell my kids that I'm not the one to like fight play with. I am the one to like snuggle with all the time. So the second they get feisty, I'm like, go to the trampoline. Yes. You can come back when you're ready to cuddle.
Yes, that is cute. Yeah.
But it has created a very, safe place for all of us to just fall into each other and really just relish in that. And so I think success to me looks like, of course, I want to be financially stable. Yes. But I also really want to have a full love life that includes friends and family and quietude and nature, and having the opportunity to really have those moments and cherish them instead of being in a hurry to make more money.
Yes. A billion times that wisdom. I love how deep you can get in a very spiritual way. I mean, that's the within that idea of spirituality. It's just so beautiful. Yeah. Thank you so much for sharing who you are, Camille. I know you're not just it's not just sharing what your work is about, but you're sharing you, like as the human divine being. So thank you so much for your beautiful presence.
Thank you. Thanks.
So I want to mention the websites. I have them here: CamilleZenobia.com, OzaCare.com. You're also on Instagram, Oral Health Activist. I'll have all those links on the podcast notes. So I think, yes, I have so many other questions here, but I won't. Yeah, I'll leave it at that. I love your wisdom. So I'll end it. I don't want to add anything else to what you said. It's just incredibly wise, kind, and beautiful. Thank you again for your presence, and we'll talk soon. We'll be in touch again.
Thank you so much.
Bye for now.
Pleasure. Bye.
Oh my God, what's not to love?
Thank you for listening. To learn more about Dr. Camille Zenobia and her work, please visit CamilleZenobia.com, AsaCare.com, and Instagram.com/Oral Health Activist.
To learn more about this podcast, please visit fitforjoy.org/podcast. Thank you again for listening, and bye for now.